Good afternoon. How are you?
Hello.
Nearly 3,000 people have signed an online petition requesting that you free up some of the federal money for small businesses. We talked about this almost 6 weeks ago. And I asked your office for a statement yesterday. They said, in part, the governor is working hard on a plan to provide additional support to small businesses. So I have a couple of questions, like, specifically what that hard work is, but also, I'm sure you talk to small businesses. You referenced the restaurants, and if you had any of the small businesses say, Governor, we get that the state's in a really hard position right now, that you have this huge budget hole to fill, and even though Congress allocated this money specifically for us and not to fill budget holes, we'll sacrifice for the big greater good. Have you had any small businesses tell you that? That don't give it to us, save it for the budget hole?
We have. So let me address it. I'm glad you brought it up, and we did talk about it before. So Congress is making this very difficult because they're not telling us whether they're going to send more money, and they've said time and time again, one of the solutions may be to just allow more flexibility with the first fund in order to fill budget holes. Having said that, listen, I hear what they're saying. I have been trying, just today I talked to the Secretary of Treasury, Tuesday we had a call with the White House, I talked to the congressmen and senators of our delegation constantly. I've been trying to get a little more visibility into what Congress might do. At this point, I am increasingly confident that Congress is going to do the right thing at the end of the month and send an additional stimulus to the states. And so with this press conference next Wednesday, I am going to be rolling out plans for how we use some of our $1.25 billion exactly for this.
So Congress said you can't use it that way, although you're hopeful. It said specifically to fill small business.
Yeah,
some
that's the
permissible. They've been waiting 6 weeks for you to say this, Governor. Some are not going to be around at the end of July. So it's nice to say I'll be back in a week. There's businesses that they're hanging on by a thread, and if they go out of business, that's tax revenue that you don't get.
There's no doubt about it. Listen, I'm sympathetic. I get it. I do get it. You also have to realize, and this is my job, and I'll own it, and I've said from the beginning, there's no easy or correct decisions, and we are trying to, we've gotten the money out the door to pediatricians, we've gotten the money out the door to child care centers, there's been over $1 billion of PPP that's been out the door to businesses in Rhode Island. We set up a small business fund, we set up a housing fund, and still we need to do more.
Control.
Actually, that's not true. Most of that is from the PPP is federal, but everything else I just said is from the fund that I control. Having said that, look, you're right. And the work we're doing, and Stephen can talk about it too, is talking to businesses. There is no way that we'll be able to fill the entire hole, but we do need to start getting money out the door into the hands of businesses.
So you talk to other governors. You tell us, I just got off the horn with Governor this and Governor that. Have you talked to the governors of Alaska, Mississippi, Louisiana, and Pennsylvania who have figured out a way to thread that needle? They have addressed the health, the contact tracing, the testing, all of those things that you talked about. They've given 10, 15, 22% of that allocation they've gotten for their state, and they've still figured out a way to balance their budget.
They have not, actually.
Have you asked them for
They have not.
Have you asked them for advice?
Not them, but I talked to plenty of governors. Let's be clear about this. They have not figured it out. They're gambling. And that may be the right choice. I am not criticizing them. Every governor is in a tough spot on this one. But I'll tell you right now, if we have to balance our state budget without another dime from the federal government, the cuts and layoffs that we're going to have to do are going to be crushing to every Rhode Islander, including small businesses. So I think it's
tens of millions of dollars if you had started what we talked about, furloughs and layoffs 10 weeks ago. You could have saved tens of millions.
Not really. We have started that. That sounds easy. Listen, here's the deal. We hear from small businesses, they need help, we're going to give them relief. We could argue all day long, should have I done it 2 weeks ago or 2 weeks from now? I have to make the best decisions I can with the information that's before me. We are in touch with businesses. We're trying. We've made PPE available. We've made cleaning materials available. There are some governors who have moved faster. I'll acknowledge that. Most have not. Most have not. That should be clear. And I'm operating in like great uncertainty. But I will say, I agree, it's time. And we're going to try to start getting the money out the door next week.
So the announcement.
So we're good. Yes. So let me tell you what we're thinking of, and how we're going to figure it out. So we are spending an enormous amount of time hearing from businesses. What do you need the money for? How quickly do you need it? Who's getting the most hit? Is it restaurants? Is it gyms? Is it minority-owned businesses, small businesses? So we're putting the, I guess, final touches on our proposals. It's most likely going to look like small grants to all small businesses who can qualify. There'll probably be something special for restaurants, maybe something to help them buy supplies, just dollars in the hands of small businesses.
How quickly can you get that out the door after next Wednesday?
Pretty quickly, like right away. We know. I hear it. I want them to survive, and we want to get the money in their pockets as soon as we can. I don't want, listen, the last thing I want is for them to go under. It's just a difficult situation, but I hear it, and it's at a point now where it's got to happen, and we'll work fast to get the money out fast, and it'll be in the form of grants, not so much loans, just cash. They need cash to pay the rent, to do what they need to do.
Governor, sticking with the business conversation, first of all, on enforcement, is that a public-facing operation that DBR will be running out? In other words, will the public be able to see these enforcement officers entering businesses and assessing?
Yeah.
Will there be an online posting of those businesses which have failed strike one or strike two or been fined? Is that something that's going to be public? And then also, what about the micro entities that, because they haven't received funding, aren't able to afford to get to the standard of safety that you're out there? You might be putting people further in the hole because they're not getting the funding they need right now, if that makes any sense.
Yeah. So I'm going to let the Commerce Secretary answer that, and then if you want me to comment further, I'm happy to.
So the governor, in describing the enforcement approach that we're taking, talked about a system where after an initial violation, typically, there would be a compliance order, or there could be a fine. There are important exceptions to that. Egregious cases, as the governor expressed it, they may actually receive one of those consequences sooner. In those cases, we are going to be posting the information pertaining to those businesses on the DBR website. That's dbr.ri.gov. And that will be a list that includes the inspectors under this task force that's interagency across the state government. So DBR will be the site at which that information will be located. And I can tell you that there have been 7 compliance orders, and there was 1 immediate compliance order. And by tomorrow, we will have information to that effect online. On your question about micro businesses, I think this gets at your question. The governor has been especially focused on the smallest businesses all along. To note, for example, in helping businesses achieve the well over $1 billion in PPP loans that businesses in Rhode Island did receive, the governor ensured that there were special efforts for smallest businesses. There was outreach with a coalition of organizations, the Hispanic Chamber of Commerce, the Rhode Island Black Business Association, and the United Way, chief among them, where we ensured that information was provided to the smallest businesses, fewest employees, with an emphasis on minority enterprises and women-owned enterprises. And we set up a special fund, as you may recall. Goldman Sachs charitably contributed. We set up a special lending system for unbanked businesses to ensure them access to federal funds. So it was not by chance that micro businesses were given special emphasis. It was very deliberate, and we're very grateful to those partner organizations for taking on that effort. We will likewise conduct outreach to the smallest businesses in Rhode Island, to minority businesses, to women-owned enterprises, when we undertake the new small business grant program that the governor has framed today.
results in timing. We're hearing from some people that it's taking up to a week, some nursing homes even staff testing taking sometimes more than that. I mean, what's causing this delay and what's being done to really speed that up?
Thank you for that question. We are very focused on this. In terms of what's causing this delay, as other states are starting to ramp up their testing, it is causing the private commercial labs that send their testing out of states to have to deal with more testing being done in those other states as one piece of the issue. We do have, within state, our state health laboratory doing a very good job in terms of turnaround time, and we have primarily focused them on responding to outbreaks and in particular handling our nursing home cases. So we are working towards a process supported by technology that will allow us to continue to do better with the in-state laboratory capacity, particularly for those commercial labs, to be able to increase the turnaround time better. We acknowledge that it's a challenge for the individuals to wait that amount of time. That's not ideal, and we're focused on addressing it. We also acknowledge that the laboratories, both the commercial ones as well as the state health lab, are handling hundreds and thousands of specimens each day. So we want to find that balance of making it so that people are not waiting 7 to 8 days and bringing that closer to a more appropriate 3 to 4 day turnaround time.
So the work being done in the state labs, well, what is, I guess, the workaround to the private labs and that delay? And also, do you think that it was premature to close the rapid testing site at Twin River on that route?
So for the workaround of what's being done, there are multiple steps in place. We are looking for and have completed the process that we're now evaluating, having strong testing partners to build capacity within the state. We're also supportive of those other commercial laboratories bringing on the instrumentation that will allow them to do testing within state and help address that turnaround time piece. And we're also looking at ways to get our technology to support the state health laboratory, maximizing the capacity they have with the very excellent turnaround time. So over the coming days and couple of weeks, we are expecting to see the improvement that we know is necessary. In terms of pulling back on the rapid ID Now test, we are still comfortable with the decision that was made there. It's certainly exposed here, but what we were experiencing with those test results highlight the importance of being able to ensure that if that testing continues, it really focuses on people who have symptoms and are being done in alignment with the healthcare delivery system, so that if there are any false negative results from that testing approach, we have a mechanism to be able to capture that. So with knowing what's there, we want to be able to continue with a small focused group and then really do the steps that I just shared on increasing and improving the turnaround time.
Governor.
Just maybe a quick question for you, Dr. Scott. Going off of nursing homes and visitations now being allowed, why take this risk now, I guess? I know outdoor visits are encouraged, but there's still that risk indoor if even an asymptomatic person goes in, takes their mask off, coughs quickly. Why take that risk now? Absolutely.
It's a challenging question to answer with two tough decisions that are there. I echo the governor's mention of recognizing how heartbreaking some of the stories are. And as I've shared with nursing home leadership, assisted living facility leadership, and as hospital leadership understands, given where we are with the data, the control that we are continuing to maintain over the virus, given what families have been patient with and have experienced, it's time. We want to do it now, do it safely, do it cautiously, and have the ability with our support to make adjustments as we need to.
Governor.
To that point, so as the doctor said, we are working to reduce the wait time with the commercial labs and frankly reduce our dependency on, there are certain commercial labs that have just taken too long, and so we are reducing dependency on them and bulking up in other areas, and so we're going to fix it. I do want to say this, though, and it's a very important thing. If you are sick, you should be staying at home anyway. So we do hear from folks saying, oh, I've been waiting for 4 days for my test. I'm anxious to know, and of course I understand that, and of course we're going to do our best to make it quicker, but they're sick. They still have symptoms. They need to be staying home. You can't go to work, you can't go to school, you can't go to camp if you're sick in any way with any symptoms. So of course it's frustrating to have to wait for your test result, but I can't say enough times, if you're sick, you have to stay home. We've been talking to businesses a number of businesses who've said they've had a handful of cases in one building, whatever, and all their quote-unquote outbreaks relate to a person going to work when they felt sick. So I just wanted to hammer that home.
Governor, Brown University announced a plan to move into trimesters. Have you seen it? Have you spoken to President Paxson? Is that the direction you think some of our other universities may want to look at?
So it's up to them. It's up to them. We have been, months ago, we set up a team on my team to deal with higher ed. We gave them a template and guidelines that they had to follow. We required every college to submit to us their opening plan so we could make sure they had a comprehensive plan. And then beyond that, we said it's up to you. I think it's innovative, and they have really robust plans around infection control, keeping the students far apart, random testing. So I'm not going to tell any other college that they should do that, but it does seem sensible to me.
And what do you want to say to the students and families of URI students? You have less of them can live on campus, and also you have the town of Narragansett trying to limit the number of non-relatives that can live in a dwelling. It's a problem for URI students.
It is a challenge. In fact, tomorrow I'm meeting with the new chair of the board of URI to really continue to get into the details. What the town did, I understand. I think it's a reasonable thing to have done. It makes it harder for URI, and there's going to be a lot of students who live in Rhode Island who are going to wind up living at home and commuting, and that is going to make their experience different. Having said that, the folks at URI are working their tails off in order to make it so that the kids can go back to school, in school, and that I support fully. Right now, if you were to say to me, like, what's my top priority, I have many of them, and small businesses are weighing on me right now, as we just discussed, it's getting our kids back to school, K through 12, pre-K through 12. I want to see kids in school, learning in person in August 31st, and I applaud URI for coming up with a plan where the students are back having education that way. The accommodation is a tough one, and unfortunately there are going to be kids. I call them kids. The older I get, the more I say kids. They're going to be students who live in Rhode Island, you know, the student who lives in Cranston, who can get an excellent education at URI in person, but they're probably going to have to commute, at least for a period of time.
Steve.
Secretary Pryor, according to McKinsey, innovative malls are incorporating value-added elements that attempt to recast the mall as the new downtown: concert, art centers, spas, fitness clubs, farmers markets. These services provide a level of leisure and entertainment that can never be satisfied online. With regard to Providence Place Mall, sales and tax revenue and occupancy continues to slide. From fiscal 18, $12.3 million represented a 14% drop. Fiscal 19, we're down to $10.8 million roughly. Given COVID, it's unimaginable how low sales tax receipts will be in fiscal 20. Accordingly, anchor tenants are in trouble and or leaving, like Macy's potentially. Questions: given the burden the mall continues to present to a nearly broken Providence, will the state avoid these deals in the future where sales tax are largely shifted from one retail sector to another, with the private state giving up millions in sales tax revenues in order to subsidize private venture construction? Importantly, has the state of Rhode Island engaged in any contact with Brookfield Properties to discuss the mall's rapidly declining fortunes? And does the future involve lowering sales tax and restaurant tax to invigorate downtown small merchants, as well as state-financed private-public partnerships?
There was a lot in that question. it is an insightful question. Yes, we've been in touch with Brookfield and its predecessor owners over the years and recently. We have been in discussions with Brookfield far preceding the COVID crisis. Obviously, the challenges faced by brick-and-mortar retail themselves precede COVID by a lot. Americans are shopping more online worldwide. People are shopping more online. Brick-and-mortar retail in its old form is increasingly outdated. People are looking for more of an experience when they visit a destination like a mall, or in some instances, whatever real estate was occupied by a mall as it's reinvented. So those are the kinds of moves that Brookfield and other major mall operators across the globe do need to consider. On the lessons learned that you're asking about, I don't think it's obvious that the problem in creating Providence Place Mall was the dedication of sales taxes to enable that mall to have its very long and successful run. I don't think that's the lesson. We have not been in discussions with the mall's ownership about any official role for the state around such a mechanism or further subsidy. It has not arisen yet, per se, not to my knowledge, and I don't believe at all. But I do think that what you're on to is the more important point, which is that malls need to reinvent themselves as centers of entertainment, and they need to consider COVID factors. So what forms of recreation will Americans, will certainly Rhode Islanders, engage in? And we're up for that dialogue. It's a very complicated question.
But just one quick point. Largely, downtown Providence has been decimated in terms of its retail presence. The presence of a mall acted to siphon a significant amount of business from downtown merchants to this location, which is now largely becoming functionally obsolete. Add COVID to the equation, and you've got an implosion happening in the small retail markets here in Rhode Island, and as a result, the true future tax base of Rhode Island is in critical condition.
Well, that's not a question, that's a set of assumptions. I'd say that I'd love the dialogue about it, but I don't think the immediate conclusion one can draw about every single mall ever created, including central downtown malls with some outward-facing retail, like Providence Place Mall, that include other functions like movie theaters and other forms of entertainment already, that one can conclude the reason downtown is failing is that mall. I think that would be a stretch. I do think that the age of centralized interior-facing retail is at least in part over, and that we need to look to more creative mechanisms. You should note that under Governor Raimondo, we created from scratch a Main Streets program where we helped Main Streets across Rhode Island revitalize themselves. Things like facade improvements at small business locations, usually retailers, whether it's curb cuts or granite curbs or better lighting, to make our main streets successful. And we've gone on to do a lot more to help small business, including the state's first ever state-financed small business loan program, all out of recognition that decentralized retail that has more of a homegrown neighborhood feel is more the future, and that as to centralized entertainment kinds of experiences, that's more what a mall needs to become. So would welcome further dialogue in the future, but I think that's responsive for now.
Last questions from Steve and then Kim.
Back to the subject at hand, Governor. Today, President Donald Trump suggested that he would withhold funding from states that do not open their schools in the fall. Do you find that your plan to reopen schools in the fall is in keeping with his desires? Do you see anything at odds in your plan to go back to school with his?
So, first let me say I don't agree with that approach of governing. The president has been so clear from the beginning that, he said to us all the time, you governors, you're on your own, you make the decisions that you think are necessary in your state. Wasn't even really there when we needed the support. So for him to then say, despite what's happening on the ground in your state, I'm forcing you to go back to school, otherwise I'm going to withhold aid, I think it's irresponsible, dishonest, and reckless. Having said that, I want to get kids back to school in Rhode Island. And I think we have a good plan for that to happen. I know there's anxiety about it. I know superintendents it's a lot of work for them. But our plan, our goal, what we're going to do is to enable kids to go back to school. And we're going to use some of our COVID money. We already sent out $50 million to school districts. And we're planning to send out $50 million to school districts to help them. You know, more cleaning, more transportation, et cetera. So bottom line is, I think it's vital for these kids to be in school, and we have a plan to do that in Rhode Island. And whatever the president does, I suppose, is up to him, but I'm going to do what's right for Rhode Island, our school children, and our community.
Thank you.
Dr. Scott, I think this question is probably more for you. My colleague Eli Sherman has been really closely watching all of the data, and it appears that the state has revised its testing data to show that more people have tested positive than what was originally reported. And his calculations show that the all-time positivity rate jumped today from 6% to 10% because of that revision. Can you just explain why that happened?
We have updated our database overall. We did a revised approach with it. The percent positivity rate, I want to get back to you clearly on where we are with that number today, based on those numbers, knowing that we're continuing to collect the numbers in. What we have shown is what the number of total tested were, and then what the number of total people in terms of the actual individuals who were tested, knowing that some people could get a test more than one time. And we've wanted to be able to provide that data in more detail on the website.
So the data now shows just the individual people who are tested versus, if someone had been tested 2, 3, 4 times, it eliminates that. Should people be concerned, though, that this seems to show a higher positivity rate than what we had been reporting for some time?
So just to clarify the first part of that, we are continuing the total number of tests and then adding the number of people who are tested as part of it. We continue to have an overall very strong percent positivity rate. So I would not say that there needs to be a different interpretation on that, and we'll be able to provide some further clarity for you and for Eli afterwards. We have acknowledged that particularly our communities that were highest hit, that had more than 20% positivity rate, have decreased to that single-digit number along with the rest of the state. We continue to keep our eye on the ball, knowing that we need to continue to monitor, make sure that we're watching the right indicators and responding to the outbreak data that we are getting in real time so that we can identify any early warning signs of where we may need to focus in a more pinpointed way.
Governor, quickly, just before the last question. You talked about tourists coming to Rhode Island, getting tests, having to pay, and all that. What about Rhode Islanders who are traveling to Texas, to Florida, to some of the southern states, coming back, and they don't want to have to quarantine? They've been down there for vacation, they've been down there for business. They're Rhode Islanders, they're coming back. Can they get tested for free, and where do they go?
Yes, the policy I said about paying out of pocket is just for non-Rhode Island residents. If you're a Rhode Island resident, you can come back and, go wherever you want. What's that?
The portal.
Yeah, you can go wherever you want. You can call your doctor and get tested. But we have this portal, which I have portal.ri.gov, where they can go and get set up and have free testing.
The policy's the same. You either have to get tested or you have to quarantine.
Exactly. Right, exactly. So if you're a Rhode Islander and you go on, you drive your kids back to college in North Carolina, and they're more than 5%, you come home, get tested, but we'll cover it. Portal.ri.gov. But if someone's from North Carolina coming here, they have to pay. Or you can quarantine for 14 days. Clear? Clear? Okay. Thank you.